This is Heart Rhythm TV. I'm Roderick Tung. We are amidst the virtual American Heart Association sessions, and with me I have Christine Albert, our president of HRS, and the lead author and PI of a very new, exciting, late-breaking study all about vitamin D and fish oil in atrial fibrillation. Christine, welcome.
Thank you, Rod.
So this has been a subject of a lot of debate: fish oil, atrial fibrillation, whether it potentially could be antiarrhythmic, proarrhythmic, and then vitamin D has caught a lot of attention with COVID, actually.
Yeah.
And then me being in Chicago, I just started taking vitamin D, and I understand that there's a paucity of randomized trials. And what can you tell us about this randomized trial that you're presenting at AHA?
Sure, thank you. Well, it's a large, simple trial where we took 25,000 people who were already enrolled in another trial looking at fish oil and vitamin D and cardiovascular events. So all of these people had no cardiovascular disease to start with. 25,000 of them, which were reached by mail. We sent them questionnaires, gave them their medications and their supplements by mail. And we had over 25,000, 50-50 men and women, 20% Blacks. And we started confirming atrial fibrillation from the beginning of the trial. And actually, it's the first real primary prevention AF trial. And a lot of interesting issues came up, like when does atrial fibrillation actually start? But we ended up in the end with 900 confirmed AF events, confirmed by medical records. And they were pretty much equally split between the two treatment arms for both vitamin D and for omega-3s. So we saw a hazard ratio of about 1.09 with a p-value of 0.19 for both for intention to treat.
So in some regards, Christine, this could be very good evidence to show at least it's safe for those that are actually taking fish oil, because as you were mentioning to me earlier, there was some discussions that atrial fibrillation could be promoted with fish oil.
Yeah, there've been a lot of small trials looking at fish oil and recurrent atrial fibrillation. And those trials overall were null when you put them all together. But the most recent trial from the Reduce It investigators, which used a very different formulation. We used fish oil, very low dose, well, not low dose, but 1 gram. And they used a purified icosapentaenoid ethyl, which is EPA, purified EPA. And they found that there was a slight increase in the hospitalizations for atrial fibrillation. And that wasn't a primary endpoint. Their primary endpoint was cardiovascular disease, and they found an overwhelming benefit there of recurrent MI and cardiovascular death. But they found like a 3% versus a 2% risk of hospitalization, more so in the treatment arm. So there was some questions that, is this real? Is this a side effect that we have to worry about with this medication? And so at least for the regular fish oil, which was about 850 milligrams of EPA and DHA, we did not see that.
And do you think that there are further studies that are needed, or do you think we put this to rest with this? The 25,000 patients, 900 AFib episodes, is this put to rest, or what needs to be done in the future, Christine?
Well, I think what needs to be done is, I think we need to do primary prevention trials for atrial fibrillation. I don't think we need to look at fish oil or vitamin D for primary prevention of atrial fibrillation. I don't know that you could. I mean, we can't completely rule out a small benefit or a small risk, but we were 90% powered to detect a 20% reduction. So, I don't think that revisiting this particular intervention, but as you know, atrial fibrillation is growing and it's associated with so many comorbidities afterwards, and it's tough to treat. We're good at ablation, but we're not perfect, and it would be really great to be able to prevent. And as you know, there's a lot of potential lifestyle interventions, but hopefully when people do therapies of agents that are going to impact cardiovascular disease, they add atrial fibrillation so we can learn. There have been hypotheses that statins would prevent atrial fibrillation, but nobody actually really did a rigorous trial to show or not show that. And it'd be nice to know. So I think, I hope that this will spur other investigators to do more research in primary prevention of atrial fibrillation.
Fantastic. Well, congratulations to you and all of your collaborators and co-authors. We look forward to seeing this in press. I guess for all those that are actually taking fish oil and vitamin D, a safety signal is really good here. Even though we
Yes.
didn't get a home run, we're not taking vitamin D now in fish oil for AFib. But this is incredible, and congratulations, and thank you for representing us at AHA.
All right. Thank you. Thank you, Rod.
Thank you, Christine.